The following program is in no way intended to replace your doctor's advice or treatment program, nor should it be used as a tool for the purpose of self-diagnosis.
Good evening. Go Blue. That's the theme for World Diabetes Day tomorrow and World Diabetes Month of November. So you'll notice this evening we're with Dr. Claude Khan once more, community diabetologist, and he is going to be sharing with us on the main aims of World Diabetes Day 2019, the 14th of November, Thursday the 14th of November.
Yes, it's tomorrow. But the Diabetic Association of Trinidad and Tobago, and I had Mr. Andrew Dano with us a few weeks ago. They have been emphasizing the whole month. So they've been doing a series of activities, educational symposiums, television interviews. In fact, tomorrow, I think, on several stations, I think CNC3, there are several interviews of patients, etc. So this year, the International Diabetes Federation has labeled the World Diabetes Day as Diabetes and the Family.
Right. So the focus is on the family and how they support and diagnose. And
right. So yes, we know that diabetes can affect, well, it does affect the whole family. Very often when patients come in, they come in with either children or if it's a young person coming with their parents. So there are three pillars that the IDF is trying to focus on. One is early diagnosis of family members, so raising the awareness that once you have a family member, especially a parent or a sibling with diabetes, you have a high risk of diabetes. Prevention of diabetes, now that's a big thing we can talk about tonight, because a lot of people ask me, can diabetes be reversed? But the real emphasis should be on prevention of diabetes, and then thirdly, the proper aggressive management of diabetes to prevent complications.
right. So that's a three-pronged focus.
Yes.
Discovering it, preventing it, and managing.
Treating,
Yeah.
yes.
Okay,
Yes.
great. I think you wanted to share with us a slide or a little
Well, it's a
clip
little
to
video,
begin.
yeah, a little, just a 15-second clip from the IDF on this year's World Diabetes Day. So we could just play that to kick off the program.
Okay, so that's a nice introduction.
Right.
And I notice you're wearing your blue circle.
Yes, you helped me to
So,
find it
yeah,
tonight.
finally found
Yes,
it.
the blue circle. But you notice it was a very quick, just 15-second clip.
Yeah.
But 1 in 2 people are undiagnosed. Now, just think about that. We are saying,
50%.
right, and we are saying that the prevalence of diabetes in Trinidad is between 13 to 15% that we know of, and that's about over 100,000 people. If we are saying that 1 in 2 might be undiagnosed, it means that there are another 100,000 people probably
there.
walking around with diabetes, which is it's quite
Phenomenal.
frightening.
Yeah.
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 Yes.
I just wanted to share a little bit about the why the blue circle, because I'm all into symbols and icons and things. So this blue circle, I think, was chosen in 2006, almost like the pink ribbon that symbolizes breast cancer. Whenever we see the pink ribbon, we are automatically associated with breast cancer. So in 2006, the International Diabetes Federation decided to choose this circle as a symbol, because in certain cultures, the circle symbolizes health and life. And they also wanted to look at the whole idea of unity, because we need to be unified in our approach to dealing with this disease. And that's where the family comes in. The family has originally been the foundation of unity in our society. So I think it's quite appropriate, and that was an excellent introduction to the topic.
Right. So we this program tonight, we're wanting to educate people. I know we're going to open up the telephone lines later on, and you have the number.
652-4855, 4855.
Unfortunately, we don't have the WhatsApp
Access
messaging
tonight?
service tonight, so you're going to have to ring us on that number later on or tomorrow on 482-4269.
Okay. All right. So diabetes as a global emergency.
Right. So I wanted to bring up slide 2 on the PowerPoint slide pack that we have. And okay, so all of it is not coming up, but what it shows, it's some highlights that the ever increasing number, this was 2017 figures, and what it shows is that 10 million more people, adults, have diabetes than 2015. So just in 2 years, you have 10 million people worldwide. 34 million more adults are at risk of developing diabetes from 2015 to 2017. 8 million more adults above 65 years old with diabetes than 2015. Well, we have US figures of 54 million more spent. 19 million more adults with diabetes are undiagnosed.
Right.
And the second to last one is quite important. 1 in 6 live births are affected by high blood sugars in pregnancy. And over 1 million children have type 1 diabetes.
Those are startling statistics.
Yes. And one of the things, you know, that we often ask is the different types of diabetes. And I know this is going back to basics, but we have type 1, type 2, and gestational diabetes. Now, I think someone asked you just recently, is there type 3?
Yes, she was asking me whether there's a type 3 and whether it's now called Alzheimer's.
Well, it's an interesting concept. Type 3 diabetes has not been officially labeled as type 3, but the process of Alzheimer's disease is deposits of a protein called amyloid, and that same protein is found in the beta cells. So there seems to be a link with amyloid deposits in Alzheimer's disease and type 2 diabetes. But in fact, type 2 diabetes is often associated with another type of dementia called multi-infarct dementia, where if you do CT scans on people who have had diabetes for 20, 25 years, you often see shrinking of the brain, and especially the frontal cortex, and you see little areas of infarcts over a long period of time. Almost, I don't want to call it mini strokes, but it's almost like mini strokes. So diabetes is a vascular illness that can affect the brain and cause dementia.
Are there other organs, obviously, that it does affect as well?
Well, it affects
the heart,
almost every organ in the body.
Yes. I was interested in the key message of the 2019 World Diabetes Day program, that within the family, it's very, very difficult for parents to diagnose type 2 diabetes in particular. Was it type 2 diabetes in particular? And so, you know, we need to be able to recognize those symptoms and help families, educate families into how in that area.
So this is one of the problems we've been talking about. People ask us, and maybe one of the slides we were going to show was some of the symptoms of diabetes. But the problem with especially type 2 diabetes, but even type 1 diabetes, type 1 diabetes comes on more suddenly. It's most times it will present early on in life. So we have young kids. In fact, last Sunday, one of our patients was profiled in the Sunday Guardian, and she's been diabetic since teenage years, and she's now 30, type 1, but living successfully with diabetes, and she's a business person. She's doing fabulously well. So type 1 presents more suddenly, but the type 2 diabetes is what can come on very, very
subtly,
innocuous, very subtly, and you don't have the typical symptoms that people look out for.
And that's why in a family it's important that we need to know.
That we raise the awareness that people are at risk of having diabetes, and you start testing, and we can talk about what kind of testing at an early stage.
But I guess one of the main things that a family can do is deal with the eating and exercise and the lifestyle habits that you develop as a family.
And so the second of the three pillars of this year is prevention of diabetes.
Right.
And, we can talk a little bit about that because, again, patients come in and ask, Doc, how can I reverse diabetes? And sadly, for many of those patients, what I have to say to them is the process of you becoming diabetic started maybe 15 years ago. You may now have been diagnosed, people going for a routine eye test, or they may go for a routine medical or for an occupational health check, and they find out that their blood sugars are 300, and there are no symptoms at all. So the typical symptoms of excessive thirst, passing lots of urine, weight loss, skin rashes, blurred vision, tingling in the feet, often will not happen until much later on in the history of diabetes. So I always say to patients that you become diabetic after your pancreas has been under stress for 10 or 15 years.
Right.
And then you...
So it's a silent progression.
It's a silent progression, especially type 2 diabetes, and people are often diagnosed in their 30s and 40s. But we're seeing younger and younger. The worrying trend here, Linda, is that we're seeing teenagers with type 2 diabetes. Now, usually we associated type 1 diabetes with that age group, but the obesity epidemic is mirroring
we notice
diabetes.
more obese teenagers.
Absolutely,
now.
absolutely. And we look at some of the risk factors for type 2 diabetes. When we talk about type 1 diabetes, of course, we still really don't know what the triggers are. And there's a lot of research going into the triggers for type 1 diabetes. Some people say it's a viral. What's interesting is that the Scandinavian countries, type 1 diabetes is much more common.
Yeah, I think you had a slide that actually indicated, what the statistic, is it slide 7?
Well, we could look at slide 3 because this shows the worldwide, well, you probably can't see that.
It's nicely color-coded,
yes,
though.
But yeah.
So you could see some of the percentages. It's lower in Scandinavian countries and higher in the Caribbean
and
Latin America.
Latin America, but also in the subcontinent. If you were to see those figures, it's over 82 million people, and it's projected by 2045 to raise to about 150 million people just in the Indian subcontinent, that whole Middle Eastern area. But right across the world, you have, even in North America, it's projected that diabetes will rise from 46 million to over 62 million.
It's interesting that everywhere there's an increase.
Yes.
So 35% increase in North America and the Caribbean, 110% increase in the Middle East and North Africa, 16% increase in Europe, and in the Western Pacific, it's gone up by 15%. That seems to be the lowest one.
So this is just showing the overall prevalence and the global epidemic of, and this is really talking about type 2. So that's why the IDF said diabetes a global emergency. And that's quite, we can come off the slide, that's quite a hard-hitting statement. We often think of HIV or Ebola as global emergencies, but we're saying that diabetes is a global emergency.
But it's that it's a non-communicable disease.
Right. So this is the change in transition from talking of emergencies or epidemics as communicable diseases. And let me just make a plug for immunizations again. We're in the flu season, and there's a lot of confusion about people asking whether H1N1 is the same as influenza virus. In fact, H1N1 is synonymous with the influenza virus, and the Ministry of Health has put out a very nice a little logo, or it's telling you the difference between the common cold.
And the poster.
The poster. Thank you, Linda.
Compares the two.
Yes,
that-
you're the ESB facilitator. You helped me here. And it tells you very nicely the difference between the common cold and H1N1. So immunizations are important. So coming back to communicable diseases, things like smallpox and polio and TB have almost been eradicated, yet they're still the anti-vaxxers, as we call them. The anti-vaxxers are trying to encourage people not to immunize their children. And I want, Linda, you know I get passionate. Can you forgive me for a minute? Please, if you don't understand medicine, please don't tell people not to immunize their children, because then the people are dying. Children are right now dying of measles in some parts of America, in Africa, because the rates of immunizations have fallen. And in order to maintain what is called herd immunity, you have to have a certain level of immunization in the population. And unfortunately, lots of people are not being immunized. So just for the flu season, influenza season, not everybody needs to be immunized. And I know we're going off the topic of diabetes,
Yes,
but diabetics...
But it's families
Right.
that have to participate
Yes.
in this.
So diabetics are, in fact,
prevention.
one of the high-risk groups that need to be immunized. Asthmatics, hypertensives, people with COPD, and people over 65, and infants. Those are the high-risk groups.
And diabetes is one of them.
Yes.
So, okay, so key messages for World Diabetes Day on the November the 14th, that's Thursday. Wear blue. That's the note that we're saying go blue tomorrow, go blue on Thursday, to highlight diabetes as a non-communicable disease that has reached emergency levels.
Yes.
Okay. Is there something else you want to share with us?
Oh, I thought we
before
were going to a break. We don't have to go to a break. So I wanted to bring up slide 7. Slide 7, which again is talking about diabetes by age. And you can see we're comparing 2017 to 2045. And look at the number between 45 and 79 years old. The number of people with diabetes will go up from 98 million to 191 million. That's almost 100% increase. And those in the 20 to 64 age group will go up from 327 million to 438 million. So by the year 2045, we now have about 350 to 400 million people with diabetes. By the year 2045, we're going to have about 600 million people with diabetes.
Yeah, that's pretty frightening. And actually, in 2017, there were over 4 million deaths due to diabetes.
Right.
So we really do need to keep plugging this Go Blue theme and the way that families need to get involved in the management, prevention, and education of diabetes. We go to our first break now. When we return, Your Health, Your Choice, we'll continue focusing on the key messages for World Diabetes Day in 2019.
Looking for a safe place for the whole family? Well, now you found it. We are ACTN The Voice, your family-friendly station. Whether it's current affairs, kids and classic TV, sport and community features, Christian and music programming, plus so much more, ACTN is the station for you. Join us each day for programming that puts morals, values, and family first. We are ACTN The Voice, your family-friendly station.
Exclusively on ACTN The Voice. This is Messenger TV. Join us as John and Lisa Bevere equip and empower generations of Christians, both young and old, developing uncompromising followers of Christ who transform our world. Starting on Mondays at 8 a.m. with repeats to fit any schedule. Tune in, log in, or click on the word like never before. Stay tuned for a new experience from the Word of God with Messenger TV, exclusively on ACTN The Voice.
You're watching ACTN, The Voice. ACTN The Voice, your family-friendly station. ACTN, the voice of Christmas.
Welcome back to Your Health, Your Choice. And the theme for World Diabetes Day and World Diabetes Month of November is the family and diabetes. So we're helping people to detect diabetes early so that the entire family can be involved in this process. And I know you have a clip you want to share with us.
And the two other, we want to reverse, so we're going to come back to that. How can people try and prevent the onset of diabetes, or even there's a concept now of reversing early diabetes, which is a big area we can talk about, and then preventing the complications of diabetes. But yes, we have a second clip which is slightly longer. It's about 5 minutes, I think.
Okay.
I remember clearly early days when we find that Oliver was diagnosed with diabetes. It was a hell of a shock.
La familia sí sufrió, la familia sí lo padeció. Les cuesta asumir lo que es esta condición.
Sim, lembro-me, foi bocadinho um choque. Pronto, não estava à espera, não sabia o que era.
1 in 11 people currently live with diabetes. Half are undiagnosed. Diabetes concerns every family, so spotting the warning signs and knowing what to do is vital.
I became very lethargic, always drinking a lot, always weeing a lot as well.
He was just over 2.5 years old. I found it difficult to accept it as a perfect child.
My first recollection of having diabetes vividly, I think I was probably about 7 years old. And that's the first night that I injected myself, because my mum always did it for me. And it hurt like it always did.
You're more or less powerless, because although you want to take that pain and suffering away from him, but you can't. And that was tough, that was difficult.
People with diabetes have an increased risk of developing a number of serious health problems. Early diagnosis and treatment is key to prevent life-threatening complications.
Descubrí que tenía diabetes porque aparecieron unos síntomas en mi cuerpo extraños, llamativos. Uno de ellos el excesivo cansancio. Realmente no podía estar en pie durante mis horas de trabajo. Me picava mucho la cabeza, tenía muchíssima sede.
É importante que as pessoas saibam quais são os sintomas da diabetes, seja diabetes tipo 1, seja diabetes tipo 2, porque quanto mais cedo for diagnosticado, mais fácil é para tratar.
Bueno, nosotros nos enteramos que Francesca tenía diabetes, más que nada porque hacía mucho pis, tenía mucha sed, mucha hambre. La cuidaba una mamá amiga nuestra y justo ese día que la cuidó, Francesca reventó 9 pañales de pis en 3 horas más o menos, pero reventados de pis.
Por este tema de que no se hace el control de rutina, digamos, no se hace como control de rutina. Y como los síntomas no están tan... no lo sabe todo el mundo. Uno cuando hace mucho pis se cree que tiene una infección urinaria, que es lo mismo que nos dijo la doctora en ese momento.
I think it affects more people than people realise. A lot of people that I've met and talked to about it all seem to know someone that's got it, whether it be really close or quite distant.
É muito importante a família estar presente, é muito importante a família aceitar, e são os primeiros a quem nós recorremos, nós que temos diabetes, a quem nós recorremos a pedir ajuda, a pedir apoio, um abraço.
E agora faz parte da minha vida, agora eu faço parte da vida da diabetes da Alexandra e somos felizes. E não interessa se é solteiro ou casado ou junto, é possível ser feliz com diabetes, sem problema.
A minha mensagem é que apareceu-nos a doença, é crónico, mas a boa notícia é que temos tratamento e conseguirmos fazer uma vida recheada de momentos felizes se cuidarmos bem de nós.
Yo me siento muy feliz cuando veo a las familias que apoyan y acompañan a las personas que viven con diabetes. Eso nos está diciendo que sin duda podrá vivir una vida plena y feliz. El apoyo de la familia es fundamental. Lo necesitamos todos los días, las personas que viven con la diabetes lo necesitan todos los días.
If diabetes is not detected early, it can lead to serious disability or death. Know the signs and symptoms to protect yourself and your family.
I remember clearly we find that Oliver was diagnosed with diabetes. It was a hell of a shock, but the most important part was time. We needed time. And now Oliver is a young man, 22 and a half years old. We've got to forget about the past. You learn something today, you've got the experience, support, protect.
Well, thank you for sharing with us in that clip. I thought it was quite a fascinating way that they did a global approach.
Yes.
You saw how it affected people from all different parts of the world. And even if you didn't understand the language, you could hear that word familia and diabetes right through.
Yes.
And reinforcing the message that the entire family needs to be involved.
Absolutely. And I just want to really talk again as we go on about the Diabetic Association of Trinidad and Tobago. I think under the leadership of Mr. Andrew Danu, the previous presidents, Mr. Carlton Phillip, Mrs. Zubida Ragbersing did fantastic jobs. Andrew is a little bit younger, and he's bringing in a lot of innovative technological ideas as well. Facebook, in fact, I'm just looking at the site here. I think you mentioned he talked about a 5K run.
Yeah.
If you need to ring the Diabetes Association of Trinidad and Tobago, their main offices are in Chaguanas, and the number is 672-0864. 672-0864. We'll give that number again at the end if you want to find out about a 5K run. And there's also a symposium, I think, being held later on in November in honor of Mr. Carlton Phillips. So the Diabetic Association is doing a lot of excellent work, and they're partnering with a lot of organizations and medics. And more, we're hoping that more medical doctors will get involved. Traditionally, the Diabetes Association has been more aimed at the lay people, but the American Diabetic Association is really driven by a lot of professionals being involved. So I think Andrew wants to get more doctors, diabetes educators, etc., involved in this process.
I think one of the messages that came out of the 2019 conference was that 1 in 5 health professionals do not receive any postgraduate training in diabetes, and we need to get them involved.
So we can talk a little bit about that, because we have been trying to raise the profile of the need for postgraduate training in diabetes. Now, traditionally, diabetes fell under endocrinology as a broad specialty. More and more in the UK especially, family doctors like myself were developing a specialty interest in diabetes, and I went on to do the master's MSc in diabetes, which now several other doctors have done since I shared that with them here in Trinidad. And even 1 or 2 of our diabetes educators, they've been able to do it online from Cardiff University, Warwick, and it's more the English universities who offer this program, because the concept of diabetes care, I think sometimes hospital doctors, and forgive me, my hospital colleagues for saying this, people based in the hospital tertiary centers look at diabetes as a hospital specialty. Really, diabetes is more positioned in the community, because we want to pick up diabetes at an early stage. We want to put strategies in place to prevent people from becoming diabetic and prevent what we'll talk about, the complications of diabetes. So really, we need more for our doctors, primary care physicians, developing a specialty interest in diabetes. And when we say diabetes, this is not just a sugar disease.
No.
Diabetes is now considered a cardiovascular disease. And, we can tell stories, and I don't want to go into it because it's very personal, but we can go into stories of people having heart disease, strokes, etc., and at an earlier age than they should do. So if our nurses, we need more diabetes educators, Linda, we need more of our doctors trained in diabetes care. Although you do it as part of your undergraduate training, diabetes is so rapidly progressing, you really need some postgraduate training.
Yeah, I mean, when you consider that it's a leading cause of death in, through heart disease, stroke, blindness, kidney failure, lower limb amputations, all of those things are going to affect a family. So the family does really need to get involved in the treatment, management, and prevention.
You know, and when someone has a stroke, for example, and there's significant disability, that changes not just that person's life, but it changes the whole family's life. By the way, I think we were going to mention a telephone number for people to ring in if they have questions. 652-4855 if you have any questions for Dr. Khan. 652-4855, and he will be prepared to answer any questions you have on diabetes and other related issues. Medical, yes. So we were going to show slide 10.
I'm sure Josh is ready.
Yes. So this is a nice slide, and it says diabetes occurs. So this is giving the underlying, what we call pathophysiology of the cause of diabetes, although we talk about the ominous octet. These are the two main causes. Diabetes occurs when there are raised levels of glucose in the blood because the body cannot produce enough of the hormone insulin, or the body cannot use insulin effectively, what is called insulin resistance. So I just want to spend a few minutes.
That's another key message from the World Diabetes Day 2019.
Absolutely. So the effect on the pancreas, and the pancreas is the organ that's just positioned behind the stomach. Some people, you know, ask me, can we do blood testing to show how much insulin the pancreas is producing? That's not a particularly easy test to do, and it's not always very accurate, but we can do indirect testing to differentiate between type 1 and type 2. There's something called the C-peptide levels, anti-GAD antibodies, or islet cell antibodies, but we don't do that very often unless we are not sure someone is type 1 or type 2. But what that slide showed is that the two main causes is that the pancreas is not producing enough insulin, and secondly, even the insulin the body is producing in type 2 diabetes is not effective. And what do I mean by not effective? And I want to debunk one of the myths that insulin is bad for you. Insulin is probably one of the most important treatments. Not everybody needs insulin, but when you come to a stage where your beta cells are almost not functioning, you can throw herbs, you can throw cannabis oil, you can throw tablets that I give Linda, metformin, diamicron, Januvia, Forxiga, Invokana. The blood sugars will remain high. The patient needs insulin, and we need to intervene to give that patient what they need. But then you have the other part of this, why some people need huge amounts of insulin. It's called insulin resistance. And it has to do with body fat and genetics. So the more fat you have, the more resistant you become to insulin.
Okay. I think we have a caller on the line.
Good evening. Good evening. My name is Judy, and my HbA1c is 7.4. Can you explain for me, please?
So 7.4, I am assuming you know that you're diabetic. 7 point. So the HbA1c, and I'm glad this caller has called in talking about that test. A lot of my patients still don't know what the HbA1c is all about. A lot of patients in the health centers, I have to say sadly, and I want to say this to the Ministry of Health and to the Minister of Health, that some areas still don't have the HbA1c available. You cannot manage diabetes effectively without an HbA1c, at least done once or twice a year. What does the HbA1c tell you? It tells you your average blood sugar for the last 3 months. So your A1C 7.4, there's a calculation, there's a table that the American Diabetic Association and the IDF gives, that works out that your average blood sugar for the 3 months prior to that test has been running around 160 to 170, your average.
Is that good or bad?
Right. That's not bad, but it's not where we want. Now, the voice sounded younger.
Concerned, yeah.
Yes, but I don't know how old. But if someone is 85 years old, now this is the, pardon me for saying this, Linda, this is the art of doing medicine. One cap doesn't fit all. Omega XL cannot cure everyone. Sure Cure cannot cure everyone. Giving someone a colon cleanse cannot cure everyone. Similarly, the same tablets are not ideal for everyone, and the same A1C is not ideal for everyone. So if someone is 85 years old, I'll be happy with an A1C of 7.4. But if you're 40, 45, I want your A1C to be more towards 6.5. So 7.4 is not bad, but there's a little work to be done on that.
I hope that answers Judy's question.
Yes. Thanks for calling in.
Thanks for calling in, yes. Okay, so one of the key messages for World Diabetes Day in 2019 is that 80% of cases of type 2 diabetes are preventable, 80% preventable, because of the adoption of a healthy lifestyle within families.
Right.
And remembering that the theme for 2019 is diabetes and the family.
Right. So I just wanted to show slide 12, which summarizes what you just said. Slide 12, and it just summarizes there are cost-effective and evidence-based solutions to reverse the global type 2 diabetes epidemic. So I just want to say that again. There are cost-effective and evidence-based solutions to reverse the global type 2 diabetes epidemic.
That's heartwarming. That's good. We have another call on the line. Can we have your question, please?
Hi, good night. Hello. Hi, good night. Hello.
Yes, can you hear us?
Yes, good evening.
Okay, good evening.
I would like to tell you that I enjoy your program and I look forward to the program on a Wednesday night.
Thank you.
However, I'm 63 years old and I had an A1C done about 2 months ago and it was 5.9. How critical is that? Would you say that that is pre-diabetic, or I am in a free range, or can you explain to me?
Okay.
Thank you.
How old?
How old are you?
63.
And the age really doesn't matter there. But okay, 5.9. Again, the guidelines are that if you have an A1C of between 5.7 to about 6.5, you fall into the pre-diabetic range. Now, what do we mean by pre-diabetic? It means that the pancreas is beginning to struggle. If you do your fasting blood sugar, you might see just above 100. The fasting blood sugar of above 126 is diagnostic of diabetes. What I would advise this patient to do is, especially if there's a strong family history, that we have a glucose tolerance, that we do the glucose tolerance test, where you do the fasting and then you take a glucose drink and you do the 1 hour and then 2 hour. But what I would tell you, 5.9 falls into the pre-diabetic range. There are some risks associated with prediabetes, especially if you have a high cholesterol, if you have hypertension. So what I usually advise patients who come in, I do an assessment, and we look at your blood pressure, we look at your lipid profile, we look at your weight, and we are just talking about reversing.
Yeah.
Now is the time to try and reverse this progression to type 2 diabetes. And do we have another call?
Yes, I think we have another call on the line.
Yes.
Yeah.
So the way you reverse this is by eating healthily, exercise, but I do put some patients on glucophage.
Oh, we're going to another break, apparently. So I just got a little message from Josh. So 70% of premature deaths among adults are largely due to behavior initiated during adolescence. So again, the importance of the family in dealing with diabetes is emphasized in 2019 by the World Diabetes
International Diabetes Federation. Yes.
Okay, so when we return, we'll continue. I hope that the question was answered adequately on the the patient with 5.9. So we return in a few minutes with Your Health, Your Choice, World Diabetes Day, November the 14th. Go Blue.
Exclusively on ACTN The Voice. This is Messenger TV. Join us as John and Lisa Bevere equip and empower generations of Christians, both young and old, developing uncompromising followers of Christ who transform our world. Starting on Mondays at 8 a.m. with repeats to fit any schedule. Tune in, log in, or click on the Word like never before. Stay tuned for a new experience from the Word of God with Messenger TV. Exclusively on ACTN The Voice.
Every Sunday at 2 p.m. on ACTN The Voice, we will be taking you on a journey down memory lane with our Sunday classics. Relive the moments. Bonanza at 2 p.m. Little House on the Prairie at 3 p.m. Gilligan's Island at 4 p.m. Family Matters at 4:30 p.m. Hogan's Heroes at 5 p.m. The Jeffersons at 5:30 p.m. This is Sunday Classics on ACTN The Voice.
ACTN, the voice of Christmas.
Welcome back, and as you can see, we're going blue this evening. World Diabetes Day on Thursday, the 14th of November, and World Diabetes Month, the month of November, where the theme is the family and diabetes.
Yes.
And before the break, we were quoting one of the key messages from for this day, that 70% of premature deaths among adults are largely due to behavior initiated during adolescence. During adolescence, we are still within the family nest.
Yes.
And so the essence of our lifestyle and behavioral patterns have been established within the family.
And, I have to say, Linda, one of the most difficult things to change is lifestyles that have become entrenched from childhood or early adolescence. If people have grown up in homes eating badly, not exercising, not eating cereals. I'm smiling for a reason.
Yeah, we'll get into the details in a minute.
Not eating fruit, etc. When you get to your 30s and 40s, you struggle to change that. So we need to have people developing healthy lifestyles from adolescence and teenage years. So what do we mean by healthy lifestyles? We know a lot of parents really try to get their children to do well academically, and kudos for that. A lot of children are into performing arts, kudos for that. But I would like to encourage, from my point of view, for parents to get your children involved in some kind of sport. And
dance is a good performing art.
Dance, no, absolutely.
Very active. So you want to get away from inactive lifestyles, sedentary lifestyles, and you want to eat healthily.
Although a lot of boys in Trinidad may not go for the dance, they might go more for football, rugby. Well, they can dance if they want, but I'm saying that some kind of sport and healthy eating. So the key to healthy eating is really cutting back. We've talked about this numerous occasions on the amount of carbs. So less of the rice, less flour, pasta, more vegetables and salad, the white meat better than the red meat. And trying to eat, more home-cooked food rather than fast foods.
Exactly, where all the sodium and the white menaces are. Sodium and sugar are really heavily factoring in those fast foods, aren't they?
Absolutely.
So there was a study including Finland, the USA, China, and India, which established that the lifestyle modification with physical activity and healthy diet can delay or prevent the onset of type 2 diabetes.
Right.
So that hinges back on the point we were making before about this, this patient who rang in with 5.9.
Now it's a stage to intervene.
Yes.
Yeah. However, I saw a patient today who 6 months ago had an A1C of 5.9 or 6, I think. I started on a minimal dose of glucophage because there was a strong family history, and her A1C has gone up to 6.7. So now she's full-blown diabetes. Now, she's adopted a healthy lifestyle. She's trying her best, but she has now developed diabetes, but it's still in the early stages. So fortunately, she's not one of those patients who comes into the office with an A1C of 12%, which means that the diabetes has been going on for a number of years. So what I try to encourage her to see is to be positive.
Yeah.
Carry on with the lifestyle changes. But the time to reverse this process is not when someone has had diabetes for 15, 20 years. You know, I think people have to accept. I guess a lot of people are in denial. And I want to say you're only as sick as your secrets. That's the term we use in our church. You're only as sick as your secrets. Now, some people think I'm too transparent. I tell people too much. But can I just say, where diabetes is concerned, and I want to congratulate a few of my patients who have been interviewed this week. They decided to go public. And I think that is very therapeutic. It helps in your management, and it shows people that you don't have to be ashamed of diabetes. And I think that's what the Diabetic Association of Trinidad and Tobago is trying to, the messages they're trying to get out, and the IDF, that, you know, we can live successfully with diabetes.
Especially with family support.
Especially with family support, absolutely. And I am, you know, I'm an eternal optimist. I'm seeing more and more family members coming in with their either parents or their children and motivated to try and reverse some of the complications that we see.
Yeah, especially since the onset begins during adolescence.
Yes.
Is there anything you want to move on to?
I wanted to just
We have about 10 minutes left.
Sure. Oh, this time has gone so quickly.
Yes.
Slide 17, because this shows a blue circle with people, slide 17. And so that's the blue again. And it says governments and other stakeholders should prioritize the affordable and equitable access to insulin as an essential life-saving medicine for people with diabetes. Now, I know some people, so we could just go with that. I know some people may say, well, in Trinidad, we don't really have that problem. We have access to insulin. While that is true, I will just use one of my patients as an example. She was on the NNR insulin. That's now the insulin available. Do we have a question?
No, it's 10 minutes exactly.
Right, 10 minutes exactly. So she was on the NNR insulin that government in their wisdom decided to take Lantus off the formulary. Lantus is more expensive, but it is, in my opinion, and in the opinion of many world leaders in diabetes, the modern insulins like Lantus, Livomir, Apidra, Humalog, and there are even newer insulins about to hit the market, something called Toujeo, which is a longer-acting Lantus. What we are saying is that these newer types of insulins give less hypoglycemic episodes, less weight gain, and especially the rapid-acting insulins are quicker acting, and they act and they're out of the body, so they cause less hypos. So, and now some patients still come into me and they say, well, doc, you know, you prescribed 40 units of insulin twice a day, and I'm only getting 2 bottles of insulin or 1 bottle of insulin a month. So while generally I would say that the NNR insulin and 70/30 is available in our health centers and on the CDAP, I think the government still needs to look at, the Ministry of Health still needs to look at access to some of the newer insulins and some of the newer medications for type 2 diabetes, because we now have the latest class of tablets, the SGLT2 inhibitors like Forxiga, Jardiance, Invokana, that's giving kidney protection as well as heart protection, which, as you know, is a big, big thing.
So I just found this paragraph that I thought I'd share in my research. I'm not a doctor, but it says, for people with type 1 diabetes, an uninterrupted supply of high quality insulin is essential for survival.
Yeah.
And this is not the case in many countries. Almost 100 years it's been since the insulin was first used to treat type 1 diabetes. And many people with diabetes continue to have difficulty accessing the affordable and regular insulin. And they need to manage it.
And they need to manage it. And, you know, one of the, again, I come back to, and I know I am forceful on this, but you see, Linda, I sit in a place where I see people coming in who have been told they don't need insulin, they can take a herbal product instead of taking insulin, and they come in with extremely high blood sugars, already having damage to their eyes, kidneys, etc. So I really want to get the message on this celebration of World, well, we call it celebration or recognition of World Diabetes Day 2019, that for a lot of our patients, insulin is absolutely essential. So I'm begging all the healthcare professionals, be it alternative or traditional doctors, healthcare providers like myself, if a patient comes into you and they're on insulin, please think 100 times before you tell them to stop the insulin. Be sure you know what you're doing, because that patient could run into a lot of problems.
And by extension, the family runs into problems.
Absolutely.
Because that's the focus this year.
Yes.
So a diabetes diagnosis doesn't just put the individual in put strain on the individual, it puts strain on the entire family.
Yes.
Okay, so we have about, I guess, about 5 more minutes.
Yeah, I have a nice slide here, 25, slide 25, that shows you, and this happens in a lot of our health centers now, there are exercise groups. So I want to congratulate, like the La Romaine Health Center. I understand they have a exercise group. I think the Cooper Health Facility, and I'm sure lots of other health facilities have exercise groups. So exercise, especially in groups. Now we can come off that slide. Exercise, especially in groups, is
fun.
It's fun. Yes, I know you sometimes join into groups. I say I can exercise on my own, but very often it doesn't work out. I have to confess, be transparent. So, I want to encourage people to, if you're not exercising on your own, that you try to access your health center or areas where.
And that's why that 5K run that Mr. Danu is running in Shogunas is important.
And we can give the number again. You have the number?
I'm looking for the number.
Okay, we'll try and find the number.
Lots of pieces of paper here.
Yes, but we can give you the number if you ring us on 482-4269, 482-4269. During the week, we can give you the number for the Diabetes Association. But you can also go on to their Facebook site. Their Facebook site, just Google the Diabetic Association of Trinidad and Tobago, and Linda's found the number.
Okay, 672-0682 if you want to contact the Diabetes Association, Mr. Danu, about the 5K run to recognize World Diabetes Day and World Diabetes Month, where families are very important.
So I don't know how many more minutes we have.
5.
5 more minutes.
Yeah.
So we can just bring up slide 28. Which is a little bit of a complicated slide, but this just summarizes all the organs that the diabetes can affect. So it starts with the brain. People with diabetes have a higher risk of developing cardiovascular disease, which involves strokes, TIAs. It affects the eyes. It can affect the heart. It can affect the kidneys. The prevalence of end-stage kidney disease is 10 times higher in people with diabetes. It can affect pregnancies, of course, and then amputations. Every 30 seconds worldwide, a lower limb or part of the lower limb is lost to amputation. So we can just come off that slide. So, Linda, that is some
pretty
really comprehensive, but worrying statistics.
Yes.
Over the last 2 or 3 weeks, I've seen one man in end-stage kidney disease who has been told he needs dialysis and he just doesn't want dialysis. I've seen quite a few patients with foot ulcers, and if we don't act on them very aggressively, it can lead to amputations. We have seen quite a few people who have had stents done. So treating diabetes is not just treating a blood sugar. What I'm trying to do is prevent heart disease, prevent kidney damage. I'm trying to control the hypertension, control all the cardiovascular risk factors, but also
eyes.
A lot of eye patients we share between the eye specialists and ourselves, but also the mental health.
Yeah.
If we can end on that one, mental health for diabetics is very, very important.
Okay. Right, well, thank you again for sharing all of that data with us as we recognize World Diabetes Day and the theme, family and diabetes. Tomorrow, the Thursday, the 14th of November is World Diabetes Day. So please go blue, celebrate with us health and life and the unity that is needed within the family in particular to treat this disease.
I think we have one more minute.
Put your pastor's cap on, or should I do my prayer?
Right, so let me be quick. I just want to shout out Avenel Hector from Is There Not a Cause? If you see this program, Avenel is coming to our church on Sunday. And Is There Not a Cause is one of the charitable organizations that's doing a lot of work with the homeless, with countries that have been affected by earthquakes,
disasters,
hurricanes, etc. And she's coming with a group to us at Anaposis. Can I just say, within God's kingdom, all are welcome. I shared that at the church on Sunday, and that even with our imperfections, none of us are perfect. And even with our diseases and whatever we are struggling with, within the family of God, you're more than welcome. You can ring us on 482-4269 to find out more about the Anaposis Center and the Anaposis Chapel and the English Speaking Board, which is what you lead, Linda.
Yes, thank you. Just want to close with a little prayer. May today there be peace within. May you trust God that you are exactly where you are meant to be. May you not forget the infinite possibilities that are born of faith. May you use these gifts that you have received and pass on the love that has been given to you. May you be content knowing you are a child of God. Let this presence settle your bones, into your bones, and allow your soul the freedom to sing, dance, praise, and love. It is there for each and every one of us. So blessings and good evening.